if you have accommodations with adaptive services, make sure you sign up to take this on Wednesday. They're in the same kind of time frame if possible. It just aids me in getting the grades back to everybody, so I don't have a bunch of tests there and tests here, because that sometimes holds things up. Multiple choice, 50 questions. Over these first four, or everything we've done thus far. Know the different kinds, the different fields of microbiology, which we talked about. So like mycology versus like bacteriology, like knowing what the terms are, and some of that introductory material. So in that first little lecture I did, most of it was introduction, but there is some stuff in there. Like the different, like knowing there's a lot of bacteria, knowing what normal flora is, it's like the real basic stuff. Let's see. We talked about bioremediation, things like that. Just like the real basic stuff, not specific examples. Understanding nomenclature, like how we refer to bacteria, genus and species. Cell structure, we talked a little bit about that. Cell structure for bacterial cells, this is all stuff like y'all had genetic growth for prereq, so like now they have a peptidoglycan layer, we don't have a cell wall, fungi have pipe as their cell wall, bacteria don't have a nucleus, like that, like structural stuff. Now the terminology like normal flora, what normal flora is, components of your normal flora, you don't need to know like specific, it's not that there's bacteria, there's viruses. You don't have to know the specific, like what the specific bacteria are. I'm already almost halfway through it. This exam is not that bad. This is all intro. Know where an opportunistic pathogen is, we talked about that. Where you find normal flora, what sites are sterile, where you don't find normal flora. When I talked about the different parts of the body and where you find particular species, make sure you're kind of familiar with those. So I can find going through here. Let's see. Like when we talk about like the nose, I say in the nose you find Staph aureus and Staph epi. Like you know, like you find Staph aureus and Staph epi there. Like I gave you a specific example on the slides. But when you get into things like this picture of the gastrointestinal tract, I'll list like 25 different things you find in like the large bowel. Don't memorize 25 things you find in the large bowel. The point of those kind of slides is to show you see more in the colon than you do in like the stomach. You do the pH change. That's what that's trying to show you. But like back here for this stuff, like for the skin and nose and eye and ear, where I like name like specific organisms you find at those sites, make sure you know. Like there's a reason I'm telling you those things are there now. So we'll talk about something later on. You'll have an understanding of that. So I'm giving you specific examples. There's a reason usually why. That's what these questions are about. Okay, and then this is more the stuff we did today. Like the difference between what an infection and a disease is, and what signs versus symptoms are, what a syndrome is, and what a true pathogen versus opportunistic pathogen. So all the stuff we talked about today. That's a lot of this exam. About half of it. Understand infectious doses and what those are, we'll talk about that today. Understanding what a microorganism needs to do to actually establish an infection, like it has to attach, it has to invade the tissue, depending on the virulence factors it makes, it might make it more severe versus less severe infection, like knowing all that kind of terminology stuff that we talked about. Knowing that in the stages of a clinical infection, that little graph I showed you, incubation, prodromal, the height of the infection, and then convalescence, so understanding that graph, like what it's telling you. And what happens is different, like what the order is, and what the things that happen at different stages are. But, again, a lot of this is definition. What a focal infection versus a systemic infection versus a localized infection, what all that stuff is. Asymptomatic or subclinical versus chronic. This is a lot of definitions. Primary versus secondary infection, polymicrobial infections, recurrent infections. Yeah, lots of definitions on this one, most of which are from today. Know the different types of carriers, chronic, convalescent, incubation, passive, the different types of vectors, mechanical versus biological. Again, the vast majority of this one's terms. And I don't know how, I recognize a lot of faces, but I mean, most of you, how many of you had it for Gen Micro? Yeah. So, I'm assuming the rest of you that had Gen Micro talked about the same thing, so I think we're still, no, okay. My follow-up question would be then, what the hell did you talk about? But I'm just gonna go ahead and just not even, I'm not gonna ask that. But yeah, just make sure you look through the lectures. Like I said, half of this exam is just from this lecture, because it's just so thick. So more terms. Yeah, this one's the most tested on. The questions out of 50 started on this one in the 20s. That doesn't mean don't look at the other ones, but the majority is from this last one, just because there's so many terms in it. But look through it all, look through the PowerPoint slides, everything on here, I pulled directly out of PowerPoint slides. Anything that's not in PowerPoint slides, I won't touch on. The only reason I ramble about that stuff is to give you a bunch of examples that you know what I'm talking about. But everything that's on it is in here. It's all multiple choice, so they on Scantron. So bring in pencil, number 2 pencil. I always key on the blue side and blue side. I give you the whole time. So if you need